My name is Simon Brascoupé, and was the former Chief Executive Officer for the National Aboriginal Health Organization.
Yeah, and now the National Aboriginal Health Organization is a unique organization, or was, and it's dealing with a unique problem. So can you talk about why it was formed, what it's addressing?
The National Aboriginal Health Organization was originally formed to educate Aboriginal people, First Nations, Inuit, Métis people about health in the broadest sense, the physical, emotional, mental, and spiritual health. And it had three what we call population-specific centers, First Nation Center, Métis, and Inuit. And each of these centers did work in what they characterize as knowledge translation. So they take research done by scientists and Aboriginal people and translate it into language that is understood by the various target populations. So, for example, the Inuit Center did work on smoking cessation. So they would research smoking in the Inuit community. They would look at the research. They had an advisory committee that would advise them on particular health issues, and they would develop strategies and campaigns and material that was particularly suited for an Inuit audience. And I think in essence that was what was unique about NAHO, because there was no other national organization that did that type of work.
And in the most recent strategic plan, there was a paragraph quote from the Royal Commission on Aboriginal Peoples that was talking about how there is this, I guess, higher prevalence of a lot of problems within the Aboriginal population, health problems.
Right.
But it was also talking about how it's important not to just try and have these programs that address just one thing at a time, and how to look at it kind of like, what's the whole problem?
Right. Well, I guess when you look at the bigger picture, we're really talking about the impact of colonization and things like residential school and poor housing, education on the health of Aboriginal people in a broad sense. We know that people with higher education are healthier. So the higher your education you have, the healthier and the longer you live. And this is a work that's been done around the world. And so when you look at Aboriginal people, they have a low income and low life expectancy, and as well higher incidence of health problems. So they call that the social determinants of health, and that's some of the areas that NAHO stressed to try to educate people about the underlying problems of colonization and residential school on the health of Aboriginal people and how it affected people over the generations. And so the solutions people saw were holistic approach to Aboriginal people's health, not just the physical but the emotional health, their mental health and spiritual health. So a lot of the programs encompassed all four areas, and organizations like the Aboriginal Healing Foundation had healing centers across Canada that address health in a holistic way, and were very successful. I think they had 90% of the people who went through these health centers, were satisfied with the services that they were getting. And with NAHO, because we were focused on the three populations in a holistic way, First Nations, health issues, done work in a whole range of issues from diabetes, health disease, cancer, sexual health, relationships, we had dozens of publications and videos, including research on traditional knowledge, which was one of the goals of NAHO. And so people in the Aboriginal community and the health community relied on that information. And when I know I'm jumping ahead a little bit, but when it closed down, one of the things that we tried to do and was able to accomplish was to keep the website online for 5 years. So in 5 years the website will close down. But we also have made an arrangement with the University of Ottawa's medical school's library to house all the documents on their website, on their library website, and it's all in one of these little things. So what that'll enable people to do is to access that information on the internet, just like they do through the NAHO website over the next 5 years. When it closed, I did a few public talks, and one of them I did here in Ottawa, and I talked about the website, the fact that we had close to 5 million hits on the website in the last year before it closed, and close to 360,000 downloads of information off the website. And one of the guys stood up and said, "Oh, when I was diagnosed with diabetes, that's the first place he went to, was to look at the NAHO website to learn more about what diabetes is, the cause." And we know that 90% of diabetes can be cured by people changing their diets and exercising. So, but that doesn't always happen. That's why you need organizations like NAHO to educate people about their health and improving their health, or providing information that is more preventative. I think if people ate better and exercised more, they'd be in general healthier.
Yeah, and you just did mention that NAHO was closed down.
You're right.
So this was the 2012 budget?
Right.
Yeah, so what happened?
So in 2012, the federal government made a decision. They were cutting, they had their cuts, and Health Canada decided that they were going to preserve the funding at the regional level. So there was going to be no cuts to actually direct programs at First Nations level. And so what they were doing was they were cutting the funding at the headquarters level. So if you cut 10%, and say, this is hypothetical, 30% of your headquarters budget, you have 30% at your headquarters as a budget. So cutting 10% means you're actually cutting 1/3 of your headquarters budget. So that was the explanation that we got, that the government was protecting the primary healthcare services to First Nations and Inuit by making that decision. So unfortunately, NAHO funding got cut.
Yeah, and totally, and the organization is closed now.
Yeah.
Except for, like you said, the website is still up.
Yeah. So we tried to we made a strategic decision to keep the website online because people use it and rely on it, and that was one of the things that we got letters of support from communities and health organizations, the national ones, saying that it's unfortunate, don't close it because we use this information. So it's not just community members. We've done some research on who uses the website, and about 60% is used by community members, and 40% is used by researchers, students, and healthcare organizations.
So all this work that was being done, is there anywhere else that it's being done now? Have other organizations stepped up or are stepping up to?
Well, some of the work that we like, there's not funding for new knowledge translation. So as new research comes out, there's nobody out there nationally able to turn that into products, like information, brochures, or videos, or online materials. So that's not happening. But some of the programs that we had, like the Inuit smoking cessation and others, got transferred to Inuit organizations, and they're running with it. So we had some of that. The other area was the Métis Center had a statistical database that was probably, if you went out to buy it, would have been worth maybe $500,000, and that is Stats Canada data, which were translated into statistical information. So how many Inuit went to university in different provinces, that sort of thing, as well as health information. And so that was transferred to a university that's going to update that information, because they had kind of one slice of data, so now they'll have more longitudinal data. So that was transferred, and we had some other programs that we couldn't transfer because they were just too expensive for people to manage. Like, for example, the National Aboriginal Role Model Program, that we had to close that one down. And what was interesting about that program, on the surface it's celebrating youth and the accomplishments that they have had, but it was really critical to get information out, because speaking to youth is important. That they don't want guys like me to come and say don't smoke or live a good life and that sort of. They want to hear it from their peers. So that program was excellent in terms of getting messages out, because we had role models that were First Nations, we had role models that were Inuit, and role models that were Métis. And in an average year, each role model may have gone to 5 to 20 communities, and some of the role models over the years have gone to 50 communities, because they just didn't stop their work at the end of their year. And a lot of the role models have been very successful. So when the news about NAHO being closed down, it was that network, that online presence that the role models had, were the ones that actually got the message out fairly quickly. Because I found out on a Wednesday in April, we sent out a press release on Thursday, and Friday and Saturday I was starting to get people emailing me and phoning me, and it was mostly through the role models, because the role models were connected through that social media.
So, and you have been speaking about it, but can you overall talk about what's been lost?
Well, it's an interesting process to go through, because I think you don't know what's lost until it's taken away from you. So when something is taken away, in a way, the NAHO as a spiritual body, of information on health for First Nations, Inuit, Métis, it's still there. It's still available on the internet. But health issues change, priorities change, so there isn't going to be that new material coming out, and it's not going to address health issues as the health needs change over the years. So I think that's the biggest area, and I don't really see anybody replacing NAHO. I know, for example, that other organizations develop health information for their communities, but often it's done locally, and the material is sent out in hard paper copy, but you can't find it on the internet. Like when you go to search for health information on diabetes, for example, you will still get NAHO as one of the major providers of that information. You'll get government. You might get the Health Canada or other provincial governments or territorial governments coming up. But we know from the research that we've done is that community members want information that they feel they can trust. And in research that's been done on who communities trust, first it's their elders. You know, like if an elder goes around and talks about diabetes and what you need to do to either prevent or improve your health once you have diabetes, they're going to listen to the elder. Organizations like NAHO were seen as a trusted source of information, and government, unfortunately, is not seen as a trusted source of information, even though the information that they do provide is based on sound evidence. But it's like I said earlier, you know, teens want to hear it from teens, so Aboriginal people want to hear it from a trusted source within the Aboriginal community, which was NAHO.
Yeah, I think that's about everything. Is there
Yeah.
anything else you'd like to add?
No, I think I guess at least over the next 5 years we get the website going, and we've got the University of Ottawa Library is going to pick that up. But I think that there's other national organizations, health organizations like the Society for Obstetricians and Gynecologists that are developing health information. I sit on one of their committees, and we just produced a guideline for doctors and midwives working with Aboriginal people that is evidence-based, but both from a Western science and Indigenous knowledge perspective. And there are other health organizations like the College of Family Physicians Canada that are establishing these types of committees so that they can develop information and policies that are more suited to the First Nations, Inuit, and Métis audience. So in a way, that's some of the work that I've been focusing on, since NAHO has closed down, and this is sort of a interim model method to accomplish that knowledge translation work that's missing.
And I know you had mentioned before that maybe if a new government gets in,
things may change.
Yeah.
Well, I'm hoping people, I guess the thing that I saw was, once something's gone, then you realize what you're missing, and I think a lot of the national health organizations try to express their opinion that NAHO was a necessary organization, and there was quite a bit of press for several months on it. Usually these issues go away after 2 or 3 days, but this one didn't. So I think there's a message there for future policymakers, and that is there is a role nationally for a population-specific organization that develops, that is a source of trusted information on health, and develops evidence-based health information for Aboriginal people. And one of the things that we were looking at was more emphasis on women and more emphasis on urban, because the health issues aren't really different, but the context is different, and I think different types of strategies and approaches are needed. So if somebody wants to develop a national organization, there you go.
all right, thank you.
Okay, miigwech.